So anything you say can and will be used against you in a court of law. So
Oh, no.
proceed.
But not in the ecclesial
But-
court. Don't
Yeah,
worry.
but not in front of a BJC. That's what I was gonna say.
Okay. Well, do I have the floor, Larry? Okay. So can I ask how many of you are teaching elders? Okay. So
Oh,
You'll be back.
lounge has poor internet.
At least we got him on a decent
Getting
shot of his
close up.
face.
There you
Okay.
are. Yeah.
all right. So it's a lounge, airport lounge, a Wi-Fi, so it's a little spotty. So if I freeze on you, I know I'm gonna be, because your picture will freeze also. So I know that I lost you for a moment, so I'll know where to pick up. So I'm going to share my screen with you now. Whoops. All right. Okay. Well, you're gonna have to bear with me because this is my first time trying this out at the airport lounge, and I usually have like a multiple screens going. So you're gonna have to help me out here as far as I want to make sure that my presentation. All right, there we go. Okay, well, apparently it doesn't show my node here, which is not helpful. Stop share here. Let me do that again.
Edwina, are your benefits through the Board of Pensions or through the ELCA private?
Or through ELCA, yeah.
Edwina is part of our outpatient program. So
We're part of hers.
Oh, I know what it is.
Yours are probably better, that's all I have to say.
Okay.
Yeah, at the appropriate time, I have questions. Go ahead.
So you see the screen, right?
Mhm. Yep.
So let me,
Oh, this is that new program. Gotcha.
yes. You do you see my notes? You only see, you don't see my notes, right?
Provided in partnership with Quantum Health down at the
Yeah,
bottom.
that's not my notes. So that's great. Fantastic. All right. So as many of you already know that I am your new church consultant. And I covered 19 different presbyteries, which includes Utica. I do mostly Synod of the Covenant presbyteries. So all of the state of Michigan, all of Ohio, except Cincinnati, and 6 presbyteries from Western New York, plus 3 language presbyteries. We have 3 Korean American presbyteries, so I cover them as well. So, so I'm going to cut to the chase and dive right into introducing some new benefit changes for this year. So we're going to start with medical plan, and starting April 1st, which is coming up real soon. All medical plan members, practically all medical plan members except Medicare supplement plan members, will be offered a new feature called Care Navigation. And you probably have already receive a lot of emails and a lot of literature on that. It's essentially like a one-stop customer service kind of deal. Care navigation is through care navigation. Members and their cover family members will have access to their own personal support team of nurses, clinicians, and benefit specialists to basically make your healthcare experience simpler, easier, and more effective at no additional cost to you or employers. And so dedicated quantum health care coordinators will be basically your one-stop customer support throughout your healthcare journey to help you receive right care at the right place at the right time. Now, members still have access to the same Blue Cross Blue Shield National Provider Network, which is the largest and one of the best in the nation. Also, Express Scripts will continue to administer prescription drug benefits for you. However, instead of calling Highmark, Blue Cross Blue Shield, or Express Scripts customer service when you have a question about your medical or prescription drug benefits, you will now call Quantum Health. So you will all get, by the way, did the slide change for every one of you? Are you seeing a new
Yes.
slide?
Yes.
Great,
Mhm.
great, thank you. So this month, pretty soon, you're going to get a new Express Scripts card and new medical ID cards. And on it, you will have a new number. And again, this is a one-stop customer service, and it's actually much more than just a customer service. Quantum Health will be members' primary point of contact for questions about medical, anything to do with medical or drug benefits. And they're going to be very proactive. And with Care Navigations, members have one number to call for understanding and using their medical, behavioral health, and prescription drug benefits. And what you see on the screen, these are some of the things that the Quantum Health will cover. And this is just a small sample, actually, of what they can do. That is verify cover services and benefits, help with making the healthcare process easier, answer claims and billing questions, and explain co-pays, deductibles, and core insurance. They will replace lost ID cards, help members and families deal with the ongoing or complex medical issues, handle pre-certification of medical services. By the way, you will have longer pre-certification list. It's not to inconvenience you in any ways, but it's just a mechanism. It provides a mechanism for which, through which Quantum Health can better keep track of your medical history, so that they can help you better. So you will have a longer pre-certification list, but on your new card, on the back of your new card, it will have the list of those the pre-certification list on the back of it. So when in doubt, just call that number, and they're going to have the Quantum Health will have a large group of specialists who are assigned just for us. And so they're going to be dedicated, their service will be dedicated to us. And they will track refills and get help if your current medication is about to run out. Quantum Health can even help members connect with community-based resources to address housing, food, or other social needs that affect quality of life and well-being. And keep in mind that you can choose to engage with Care Navigation as much as or as little as you like. But if I were you, I'd really take advantage of this great service. The care coordinators will get to know you, and they will know your medical history. So you don't have to, like, every time you call, you don't have to explain your situation. And they will work behind the scene with your service providers, including doctors and hospitals, so that you won't have to spend so much time and energy navigating through today's complex healthcare process. So they will they're more than customer service, but they will be your partners in terms of you know, which care, you know, which doctor to see, which doctor to pay, which, you know, hospital to go to, what gives you the best option. You can make a very a great, solid, informed decision with the help of care navigation. Now then, you may ask, well, then what stays the same? Well, Medicare supplement plan members will continue to contact Highmark Blue Cross Blue Shield for customer service because the Quantum Health or Care Navigation won't cover Medicare supplement plan members. And the Geo Blue members will continue to contact you know, that plan as before. Also, members with dental and vision eyewear, flexible spending accounts, health savings accounts, and the retirement savings plan will continue to contact those service providers as before. And you may also ask, well, what does that leave for the board to do? Well, we are still your primary point of contact for pension, Medicare supplement plan, term life plan, death and disability plan, including supplemental death and both temporary and long-term disability plans. Now, speaking of temporary disability, if you are unable to work, if you're unable to work more than 14 consecutive days while recovering from an injury or illness such as COVID, you should consider applying for temporary disability benefits because your employer, your church employer is paying for it. And lately we've been getting a lot of calls about folks who are not able to work for extended period of time because they're recovering from COVID. And so if you are in that situation, you should contact Lincoln Financial and apply for temporary disability. And you have 30 days. You have 30 days from your first day of absence from work due to your disability to apply. So you shouldn't wait too long to apply for it, even though your church is probably kind enough to support you through your leave of absence. But you know, temporary disability will provide 60% of the effective salary, and it is paid weekly. And so it will be a great burden off the church if you remember, member has to apply, not the church employer. Member has to apply for temporary disability, and it will be a great help for both for you and for your church. So don't wait around. If you think, or if you are in that situation, and this benefit, temporary disability, can be available up to 90 days from the date of the disability after a 14-day waiting period. And then after 3 months, you know, Lincoln Financial Group will continue to monitor you. And if you need more than 3 months, more than 90 days, it will automatically roll into a long-term disability. And you don't have to apply long-term disability separately. Lincoln Financial Group will stay with you. They will monitor you. And if they feel that you should be in a long-term disability, they will do that for you. Now, by the way, for planned absence, for example, elective surgery like knee replacement or hip surgery, where you know you're going to be out for an extended period of time. You may even apply in advance up to 30 days before the first day you are absent from work. So if you are getting those kind of surgeries and you know you're going to be out of commission for at least 3-4 weeks, you can plan this ahead and apply up to 30 days before the first day of your absence. Now, I don't know how many of you here are tired, but I do want to talk about if you know of any retired friends, colleagues that are retired and who are in our medical supplement plan. As I mentioned earlier, Quantum Health will not serve the members of Medicare supplement plan. So the board, in partnership with Highmark Blue Cross Blue Shield, will continue to provide you the customer service. But as of 1st of January this year, Medicare supplement plan members will now have a vision coverage at no additional charge, which can save hundreds of dollars on out-of-pocket costs for glasses, contacts, and eye exams. And major retail chains like Walmart, Sam's Club, Costco, and Pearl Vision are included in your network, which is VSP. And this vision eyewear
Oh, no. We've lost you.
supplement plan members can also enjoy employee assistance plan at no additional charge, which gives you access to counseling sessions, both in person and telephonic, and financial and legal counseling, and resource for child and elder care, and much, much more. So those are two services that our Medicare supplement plan members will have this year. And then I want to mention quickly about the COVID-19 test. You're probably by now, you're probably all aware of this, but a federal, you probably heard about a federal requirement that all health plans provide 100% coverage for up to 8 over-the-counter home COVID-19 tests in a 30-day period, effective January 15th of this year. Well, the Board of Pensions has been working closely with Express Scripts to ensure our medical plan complies with this requirement. So starting February 1st, you simply present your prescription drug ID card when buying FDA-approved over-the-counter home COVID-19 test at a farm. Yes, you have a question?
Yeah, yes, I do. That was not the way it was explained to me. First of all, the pharmacies did not know what to do with it. And when I called Express Scripts says you have to apply for reimbursement. And that, that's what I was told. So if you can tell me differently or what I should do.
When was that? When did you do that?
It was in February.
Okay.
Towards the end of February.
Yeah, this towards the end of February?
Yeah.
Now, if it's a participating Express Scripts pharmacy, they should take your prescription drug ID card, your Express Scripts ID card.
Well, I'm grateful for that, because the applying for reimbursement is a disaster. Is too much to go.
Yeah, you only apply for a reimbursement if you purchased the test kit from January 15th through January 31st. If you purchase a test kit between January 15th through January 31st of this year,
this was in February. So
no, they should have taken your card. Yeah, and as long as it's as long as it's a participating Express Scripts pharmacy.
Yeah, it's Walgreens. So
Walgreens. Yeah, and then you shouldn't be charged anything as long as you don't exceed 8 tests per 30 day, and that's 8 tests per individual.
Oh, okay, good.
Yeah, so that's not even 8 tests per household. So if you're going to
I'll go stock up.
Yeah, but you shouldn't do that though, because remember, you only want to pick up what you need each time, since test kits have an expiration date.
Right.
Yeah, right. So you don't want to go all out with it. Although, I mean, I think usually their shelf life is about 6 months, to about a year. So you can it has a long enough lifespan, but nevertheless, you don't want to buy all at the same time.
Okay.
So if you still didn't get your money reimbursed, even though you purchased it after January 31st, what you should do is you should just submit the receipt showing the purchase date, and then
No, they want
then
the form too.
you just need a UPC label found on the
Okay.
test box, and the receipts to Express Scripts for reimbursement. And again, this will be so much easier when Care Navigation kicks in, because they can do all this for you. That's the beauty of it. But anyway, actually, you know what? I think the COVID-19 test is probably still administered by Express Scripts, so you probably still want to call them up. And I do want you to know that if you go to an urgent care or standalone COVID testing center or a pharmacy to get tested, those do not count toward the 8 tests per 30-day period. Those are separate. And then, of course, don't forget that every home in the US is eligible to order 4 free at-home COVID-19 tests. That's 4 tests per household. And this is separate, again, from 8 per cover member / dependent per month allotted by our plan. All right, so we have we're going to turn our attention to assistance program. Through assistance program, the Board of Pensions provides a need-based grants to help active and retired ministers, lay employees, and their families who are members of the benefits plan. The assistance program, I think everyone, I have benefit from assistance program a number of times already, and everyone at some point in your life probably will be benefited. Will get some benefit from the assistance program because it covers a lot of areas, and we made a number of changes to the assistance program this year to reflect our goal of serving more. One that pertains to, can you hear me? So 3 different categories. The first one being the members. And then the second one that applies to only the retired members and their spouses and their survivors, surviving spouses. And then lastly, one that is for only active minister members only. So I'm gonna go first with the assistance program that applies to all active members and retirees, retiree members. And first one is adoption assistance. If you're thinking about adopting a child under the age of 21, we offer adoption assistance, and its grant amount increased this year from $3,000 to whopping $6,500 per child. And then the second one is our emergency assistance. This is a one-time grant that addresses an emergency or unexpected need facing an individual member or groups of members. Now, I want to tell you, out of all the assistance grants we offer, I would say this one may have the widest and most pliable eligibility criteria. So if you are, if you think, or if you feel, let's say, you have a roof issue and it's going to cost you like $20,000 to fix it, and you have nothing in your bank, or you just can't afford it, you should actually consider applying for emergency assistance. The amounts awarded vary with the need, and it could range from a few $100s to $5,000 each. An individual may be awarded emergency assistance of no more than $15,000 in a 12-month period. So that means, I guess you can, theoretically, you can apply multiple times for different reason each time. And you can get up to $15,000 in a 1-year period. The assistance is initiated by a mid-council or employer or multiple bodies of the church who typically share the cost with the assistance program. But in a rare situation, individual may apply as well, but it's usually initiated by mid-council or church employer. Then we got transition to college assistance. If you have a dependent child who is enrolled in any post-high school education or training, college, university, community college, or technical or trade school, full-time or part-time, excluding post-baccalaureate, you may be eligible to receive a flat amount of $2,000 to help with your child's educational cost. And that is up from $1,000 in previous years. And if your child is a full-time student at a Presbyterian college or university, you'll get additional you get additional awards of $1,000. So you could get up to $3,000 if your child is a full-time student at a Presbyterian college. Your child doesn't have to be a freshman as long as he or she is 26 and under. And your adjusted gross income just has to be no more than 2 times the median effective salary. So what is the median effective salary this year? It's a $62,100. That's the median salary for this year. So twice that will be like, I don't know, it'd be more than, it'd be over $120,000. So I don't know of a whole lot of ministers or church employees that make more than $120,000 as an effective salary. So which means most of you, if not, most of you will qualify for this.
Luke, what's the minimum age for transition to college application and eligibility?
I don't believe there's a minimum age as long as that person is in college, that he or she is out of, as I said, there's a maximum age, which is 26. But, if you got a child prodigy who goes to college at the age of 16, as long as you can prove that he or she is in college, full-time or part-time, you can qualify. So the second assistance program category is the one that applies to ministers in active service only. So we have a new program. When I say, by the way, all these assistance program, when I say members, by that, what I mean by that is for ministers, that would be those of you who are either taking part in pastor's participation or minister's choice, either one of those two benefits plan, or a lay employees who are either taking pension or medical or both from us. So let's talk about, and then of course the pensioners, our retirees who are collecting our pension. So here is a assistance program that only applies to ministers in active service, ministers who are taking, who are in pastor's participation plan or minister's choice plan. We have a new program this year called Minister Debt Relief. Minister Debt Relief is for those of you who are in pastor's participation, again, pastor's participation or minister's choice, earning less than the median effective salary, which is again $62,100 this year. This program will provide grants of up to $10,000 for those who qualify. So this is for any personal debt, whether it's credit card, car payment or mortgage payment, doesn't matter. Unfortunately though, healthy pastors, healthy congregations, grant recipients are not eligible for this program at this time. However, this program, unlike healthy pastors, healthy congregations, does not involve lay leadership participation, but only the applicants, the ministers themselves in the application process. So it's actually a little simpler and easier for you to apply compared to healthy pastors, healthy congregations. Then the second one is the Minister Educational Debt Assistance. Creator for this, but that's no longer the case anymore. Now, the third one is a Sabbath sabbatical support. Now, this is something that many of you may want to consider because it provides Sabbath grants of up to $4,000, which is up from $3,000 in the previous years for eligible ministers. And so if you, you just have to participate in the either pastor's participation or minister's choice for 6 consecutive years to qualify for this. And I'm actually part of the application review committee. And let me tell you, Board of Pension wants to give money away. We are making every effort to give you every opportunity to receive the grants that are due to you. We're like we're gonna do our best to make sure that if you qualify, that you will receive. Please do consider if you are thinking about applying for any of these grants. Know that we will work with you. And again, we want to give our money away. And for the time being, we have a plenty of funds. And then lastly, the programs that are specifically for retirees, their spouses, and their surviving spouses who are 65 and older. First one is a housing supplements. Now, housing supplements help eligible retirees to remain in their homes or move to retirement facilities. And they are paid out monthly for life. So to qualify, retired members or surviving spouses must have a total annual income from all sources of less than $46,575 or 75% of median in any given year. Also, your personal assets are a significant consideration in determining your eligibility. But if you're applying for housing supplements to help you remain in your home, your current home that you live in does not count as an asset. Only the other real estate that you may hold as a rental, extra real estate other than your own home, those will count as your asset, but not the home that you're living in. And housing supplements for assisted living, if you are going to moving into assisted living, housing supplements for assisted living are now up to $4,400 monthly per individual. That means couples may receive up to $8,800 together when both are in need of assisted living. Now, in addition to monthly housing supplements, you may be eligible to receive a lump sum housing supplement of up to $20,000 to help you pay the entrance fee, because a lot of continuing care retirement community, will require you to pay an entrance fee. Well, we will help you up to $20,000 if you qualify. And if you're joining Presbyterian homes and communities, you may receive an additional one-time matching grant of up to $3,000. Now, housing supplements for at-home care are now also up to $4,400 monthly per individual for custodial care based on agency recommendation. Now, here's the best news. The required number of years in pension plan for this for this assistance grant program has been reduced from 20 to 15 years, with up to 10 years service credit for pensioners serving Presbyterian Presbyterian congregations or mid councils or agencies or Presbyterian related agencies without benefit of defined benefit pension plan participation. What that means is that it used to be that you have to be in our plan, either medical or pension or both, for 20 years. But now it's down to 15 years. But on top of that, let's say you just need to participate in our plan for 5 years, at least 5 years. And then let's say you work another 10 years for your congregation, but your congregation was severely financially limited. And it's a struggling, small struggling congregation that couldn't afford to pay for your plan, your benefits plan. So you didn't have any plan. You didn't participate in any plan, but you served at that congregation for 10 years. Well, we will count the 10 years as a service credit. And therefore, you had those 5 years with the plan, and then now you have 10 years of service without the plan. We'll count that and we'll make that 15 years, and you will satisfy the requirement for our housing supplement. Same thing with the income supplement. Income supplement will also have the same requirement, same years of plan participation, and will also credit you for that 10-year service credit. And for income supplement to qualify, retired members or surviving spouses must have a total annual income no greater than the applicable maximum. So just to kind of give you an example, if you, let's say, it depends on how many years you participate in our plan, or and whether it's a couple or a single member. But let's say you are in a pension plan for about 31 years, so more than 30 years, and you're still with your spouse, in which case your maximum salary would be $46,575. So if you're making less than $46,575, you will qualify as a couple. You will qualify for income supplements, and that's those of you who have been in our plan for more than 30 years. And I will tell you right now that the housing supplement and income supplement application is actually one of the same. It's the same application. You only apply one application for either or both. So when we receive your application, we will decide whether we will first look at your income supplement. So you may qualify for income supplement and housing supplement, or you may qualify for one only, or you may not even qualify for either one of them. But once you submit that application, we will make that decision. And then the third grant program is retiree medical grants. Now, retiree medical grants reimburse eligible retirees and their spouses or surviving spouses for dental service or hearing aid expenses of up to $2,500 per person once every 3 years. The reason that we give you these grants, the purpose of this grant is really because the Medicare supplements usually don't pay for your dental or hearing aid expenses. So that's why we're giving you this extra medical grants for retirees to help pay for your dental cost and your hearing aid cost. So again, that's $2,500 per person once every 3 years. And you may apply to be reimbursed for a single expense or a combination of expenses. So I would encourage that to maximize reimbursement, I would encourage that you wait until your receipts amount to $2,500. Now, to qualify for this grant, you do have to have 15 years in the medical plan or 15 years in the defined benefit pension plan. So no service year credit for this one, but it is still down from 20 years in previous years. And you have to be currently enrolled in Medicare Parts A and B and in a Medicare supplement plan. It doesn't have to be our Medicare supplement, it could be any Medicare supplement plan. Or Medicare Advantage plan members will also qualify for this grant. Also, your total annual income has to be less than 1.2 times the congregational minister's median, which will be $74,520 this year. So as long as you make less than that, less than $74,520, you would qualify for our retiree medical grants. Now, I want to talk about some small church friendly programs and benefit options, which can apply to both clergies and non-clergies, regardless of their employment status. First, small congregations with limited financial resource should consider share ministry, in which your benefits costs can be shared in a number of ways. Once your presbytery approves your share ministry, come talk to me about it, and we'll figure out how we can divvy up the benefit aspect of it. And second, small congregations should consider pathways to renewal. Pathways to renewal is a program that it's sponsored by the Board of Pension that reduces pastors' participation dues nearly in half, from 37% of effective salary to 21%. The dues discount runs 5 years or until the end of the employment relationship, whichever comes first. Now, to qualify, a congregation must have 150 or fewer members and not had an installed pastor for at least 2 years and not yet has elected a pastor nominating committee. Or you could be a congregation of any size. You could be 1,000 member church or 1,500 member church. Doesn't matter, as long as you're looking to expand ministerial headcount, meaning if you're looking to get additional minister as associate pastor or co-pastor or whatnot, you can still qualify as long as the minister being called through pathways to renewal is under age 40, and he or she is either a candidate for ordination or an ordained minister of the wedded sacrament, and the minister has not been previously covered under pastor's participation in the benefits plan, and he or she can be both installed or non-installed. So please do consider pathways to renewal, because it can save a significant amount of money for especially for small congregations, as well as the bigger congregations, again, who are looking to get multiple pastoral staff. The board also offers several benefits options for employees, regardless of the work hours and clergy status. These benefits can be offered to any employee at little to no cost to the employer. And those are dental plan, retirement savings plan, dependent care flexible spending accounts, and vision eyewear plan. Something like vision eyewear plan is really no brainer because it costs like $4 per person, but you're getting so much benefits from it. My entire family combined, all the benefits that we get combined will probably amount to easily in thousands, probably more than $1,000. And you only pay, as a family, we only pay like $13 and change per month. It's a great deal, and any employee, regardless of hours, regardless of clergy status. Anybody can get this plan through your employer. Small congregation may also consider hiring a retired minister who is collecting his or her pension benefits. This could be a great option because you're getting an experienced leader and you get to save money because you won't have to pay for his or her benefits, right? However, please be aware that if a retired minister is serving more than 20 hours per week, the church will be assessed post-retirement service dues of 12% on the minister's effective salary. And complete the application process. Each person should call member service to request the retirement packet 4 to 6 months prior to the anticipated date of retirement. And the retirement packet is individually generated for each member and it is sent electronically. The member then needs to submit all paperwork 45 days prior to the date of retirement. And also, each member, if eligible, each member also must elect or waive the Medicare supplement plan, and that the application for Medicare supplement plan is included in your retirement packet. Now, if you have any questions, because selecting a healthcare after you retire is pretty much, I would say, 80% of your retirement. If you can pick the right healthcare, during your retirement, I think there'll be a smooth sailing. That's where you're gonna put in the most time and effort. And as you know, once you turn certain age, once you turn about 55 or 60, you're gonna be bombarded with all letters and emails about Medicare Advantage plan, various Medicare Advantage plan and Medicare supplement plans. Well, if you have any questions, please go to Choosing Healthcare Coverage at retirementonpensions.org. This publication will educate you regarding how to conduct apples to apples comparisons of various Medicare supplement and Advantage plans, so you can make an informed choice. Well,
Hey,
that's
Luke,
yes.
I just wanted to thank the Board of Pensions for being able to work so quickly with me on my retirement plans. I was serving as an interim, and the church found called a new pastor who was coming quite quickly. They had their congregational meeting to call the person on January 9th. And I was going to be done at the end of February. So that 4 to 6 months just was way out the window.
Mm.
But I submitted, I wrote for the packet and was able to submit it on January 10th, and they were able to get it all done in less than 6 weeks. So
Oh yeah.
yeah, so it really worked
Yeah.
well, and I appreciate that.
Yeah, we like I said, we will work with you, and the Board of Pensions are pretty efficient at what they do. And it really depends on how much workload that we have. For whatever reason, in the past few months, we had unusually large, reports of death. So we're a little bit backed up in the Department of death benefits. So it really depends on the workload as well. But I just joined the board last September, and I can already tell you, I've served in a congregation. I did a parish ministry for 20 years, and then I worked for OGA, Office of General Assembly, for another 5 years. And then, before I got into ministry, I worked in a private sectors for a few years. And I will tell you right now, I'm working with the best group of people ever. People at Board of Pensions are just incredibly competent, and they are just a pleasure, just a joy to work with. I'm not saying that just because I am part of the board now, but I've always felt that way, even before I joined the board. But now more than ever, because it's just a great group of people who have the compassion, and their sole purpose is to care for you. Um, they can take the worry out of your life that involves benefits, retirement, and healthcare, so that you can focus on your ministry, or you can enjoy your retirement for that matter. So thank you, Sam. Thank you um, for that little comment, and I appreciate that. Um, is there? I know that I don't know. You never know. I don't want my presentation to be another data dump. And I want to make sure that people are getting it, and these information, this information that I'm sharing is useful. So at this time, I'd like to entertain any questions. If you have any questions or comments, I'm gonna stop sharing. And you see my contact information there. That's my email address, and then there's my direct cell phone, 609-575-6321. I had that number since my seminary days, which means I had that number for over 25 years. I got that number in central New Jersey, and got that number in mid 90s, and I kept that number ever since. Anyway, that's my personal number, and I will answer you. I will literally answer you 24/7. So unless I'm in the middle of eating or I'm sleeping, I will take your call. So I'm gonna stop sharing. Any questions? I take that as either a good sign or a really, really bad sign, but I want to say it's, I'm thinking that my explanations were adequate enough that it does not require any additional question. I hope that's the case.
Yeah, I would find it helpful to have those slides to refer to, just so I remember you mentioned a couple of financial assistance things for retirees, the medical expense part. That would be helpful just to have to refer to.
What I will do is I'm going to share. I have actually a documentation that a Word document that goes along with this presentation.
Okay.
And it'll be even more helpful to you because it's got all the every link to the program that I mentioned. So I'm going to share that with Larry. Okay. So Larry, please feel free to distribute that Word document among all your members. In fact, before I forget, I'm gonna do that right now, Larry. Okay. And make sure, I did have some issues with folks unable to open this document. So let me do that right now for you. Oh. That. Okay. So Larry, I just sent you the document. Please let me know if you're able to open it. And then you can share that with your constituents. And just going back to Jason's earlier question, we certainly have some options and benefits that can help churches that are struggling, at least financially. And then, of course, once you get your new pastor, I can help that pastor get other benefits, like minister debt relief, Sabbath, Sabbath sabbatical grant, and minister educational debt debt assistance. But for church, we can reduce the pastor's participation dues through pathways to renewal, or other programs. We got organizing pastor grant for NWCs, the new worshiping communities. And we are constantly thinking about what's next. What can we do next? What are there things that we can do to help make the churches healthier and ministers happier as well. So if you have any suggestions, or if you have any comments, let us know, and I will take your comments with me to the board, and that's how we came up with Minister's Choice plan, because there's so many churches couldn't afford the pastor's participation, and so that was that's something that we came up with, and menu options as well. That's a great picture right there, Larry. But any other questions?
No, I was gonna say, I'll probably email you some thoughts and ideas or questions, but I don't know that this time would be the best time to try to entertain them directly. So,
Okay. All right. Sounds good to me. Larry, were you able to open that document?
It hasn't arrived yet, but I'm confident it will. So I have to take another call, so I can either let you guys talk all you want, or we can ring off now.
If you have any other questions, please feel free to call me or email me. I do have a flight to catch. I'm at the airport, and so I'm gonna probably have to jet out of here in a few minutes, or probably in about 10-15 minutes.
I sent everyone your contact information in the email this morning, so
Okay, great.
everybody knows where to find you.
Okay.
All right, folks. The Lord be with you.
Thank you for being here.
Bye now.